Welcome to Design at the podcast, where every voice matters. So today we have in our midst an oncologist and also a virologist, Mr. Abel Oreoluwa. Also can say.
Okay, so you'll be coming to us on pandemics, outbreaks, and pandemics. This is Inside Your Scare podcast where anything matters. My name is Sings, and I have with me. Isharua. Yeah.
I'm fresh.
And we have Mr. Abel Oreoluwa.
Now, welcome, sir. Thank you. Sure. So, please kindly introduce yourself. And go.
Yes. Okay, so my name is Abel Oreoluwa, further the mm, a master's degree at University Biology Specialist.
So, okay, thank you, Mr. Abel. I don't know if it's Abel or not. Each one do you keep anyone? Okay, so today's episode is just all about pandemics and outbreaks. So when it comes to pandemics and outbreaks, um, I think in this kind of society, people don't really know the difference between pandemics and they don't know the difference between outbreaks. So can you just give us more like what's it called? Like it's say a snapshot or like a summary of what's details.
Okay, so when we talk about outbreak, pandemic, then you have epidemic, then ED, endemic. So when we talk about those things, they are kind of interconnected. So when we say something is endemic in a particular place, that means there is a sudden increase in the symptoms rather from what the usual symptoms should be. So, for example, in Nigeria, someone having malaria, you can say Nigeria is endemic with malaria, but it's not a pandemic. So, an outbreak, and it's not an outbreak. An outbreak is a sudden increase in the symptom in a particular place within a confined environment, and is usually to a single source. So let's say there is cholera outbreak, and this is as a result of maybe poor sanitation really or something. So it is an outbreak, the single source in a school thereabout. Then when we are going to talk about a epidemic, is that same outbreak, but it's crossing within regions, within Lagos states, Iba states. When that now move across different countries, it's now a pandemic. So it's just a differences based on geographical distribution of territory. This is
Okay, okay, thanks. So for yeah, I'll mention to more like Yahtzee, what's it called? Major history. I think I don't want to thank them myself, so I want to thank them in chat. So that like you. Okay, so time we had COVID-19 and Masaku. So we had to cook them under and zik more like you have to eat is COVID-19 is under out and outbreak or and where people can you help us posters fight.
so COVID-19 is a pandemic. It travels between different countries across the world, and it affects more than one thing. So it's and then deadly by the definition epidemic. And Lassa fever is just an epidemic that happens within different states. So we cannot really call Lassa fever an outbreak of Lassa if it is still in a state. But when it travels between God and a state, it's not a problem.
Uh, so, what are actually the main cause of that epidemic and then how this what are actually the main text and how can Adi that particular environment that is affected, how can they work towards getting better of those pandemic daily to our state?
So I'll say two or three things actually. The first one that I want to mention is zoonotic spillover. There are some diseases that travels from the animals to humans. Ebola, for example, Ebola came from a an animal reservoir and it passed to humans. So zoonotic spillover is part of it. Then there is environmental conditions, flooding and sorts can also pass this. So the disease can be shared maybe by asymptomatic individuals into the environment and maybe by erosion. It is driven to more states. So it's within that state as an outbreak. But when there is, let's say, erosion and it washes it to another state, it causes an epidemic. So, like judging by that geographical distribution, it has involved more than a single state. So it's now epidemic in regards this. Another one is Japa. So if you look at COVID-19, for example, how COVID-19 came into Nigeria was through a person that traveled to the area. So it will not have reached us if that person is in. So it can spread anyhow. There are different nodes that which diseases, pathogens spread throughout the world, and we cannot just say this is the main force.
I understand that immigration is also a mystery which I think this is one of the major these things invasion. There are transboundary diseases that pass from regions to regions. You will hear of some diseases in some part of the world that are not in this part, and the fall it is now here just because someone somewhere just found.
Yeah, but
Okay, so in a major crisis or major outbreak of the pandemic, and then the life-saving vaccine is developed. How do they ensure the distribution of that life-saving vaccine? Is it distributed based on the ages of people, maybe how young or how old or how productive they are to society, or how do they distribute that life-saving vaccine? They just distribute it generally for everybody.
So I think the military mistaking vaccine for a point of care, maybe the drug now. So when it comes to vaccine, vaccine is to prevent wherever you happy. It's not a drug. So let's say there is an outbreak, there's a mega outbreak, the vaccine will not be given to people that are experiencing that outbreak because giving them their immune system is already low. Giving them that vaccine can mutate and cause another disease. So it's now the vaccine that will kill the person, not the infection. Okay, but so it's just we can say a vaccine distribution is more or less targeted as if there is an increase of a particular disease at a place, what they do is what age do the disease affect? If it affects children, where do we have more of those children? Those are the ones that they target and deliver those vaccines to, so that you don't get what's what is bringing others down. And there's something called herd immunity. So when the immunization of one person affects the whole community, so it does not necessarily have to be that one person getting immunized. So let's say there is polio outbreak in a particular school, and the school were able to detect it early and vaccinate all the children. The one person that is the polio has been eradicated, and every other person that might have come down with the polio are already vaccinated, so they are safe. So vaccine distribution does not necessarily have to be when it happens. And the distribution, I cannot say it should be distributed based on how it is applied. It's just there is a lot of criteria for vaccine distribution.
So it is a preventive measure.
It's more of preventive measure.
So you ain't mention of them also. So and third along regarding post sanitation. So how do this case affect the overall sorry, how do they affect disease and outbreaks?
Okay. Um, I work with environmental surveillance environment of a particular organization where it tests for wastewater and tests for pathogens and disease causing organism in the wastewater. And when we were testing in Lambe, there was a time that we found Lassa fever in the water. And what happens there? So finding Lassa fever in the water, we all know that Lassa fever is passed by rats. Now, finding it in the water, we can actually tell them that there is a potential risk of maybe rats that are causing that Lassa fever in this area that has been washed down to the water system. So if there is poor sanitation, the rats that has the Lassa fever is at Mokola. But because the sanitation in Mokola is not, it washes down to another place, and people in that place get the virus now. So it's not as their own fault, not because they have that Lassa fever. The animal do not necessarily have to travel down to that place. It's just your own attitude of you dumping the nylon of the skin that you pet inside the water, causing the harm for a whole number of
So,
people also.
ordinary droppings the nylon or it does the mic. I feel like the dropping does the can I say sweets now.
You guys even talk about chewing gum that there's
Dropping it.
the not even the nylon, the chewing gum that you have chewed all the sugar out. Now dumping is if I go and block a pipe somewhere around knees. So sanitation attitude is something that I just say people should encourage to age uh, sanitation, sure. Good sanitation.
Okay, so my question is the during COVID-19, you were hearing, oh, 1,000 people, 1 million people today, tomorrow. I mean, I was kind of confused as well because data is for me. I think data is not something that I just call anyhow. Let me just put it that way. So during this outbreaks, could be pandemics, outbreak, but like how important is data when it comes to that?
So, I think the issue that most people have with data is that we don't want to accept the fact that sometimes the data are terrible. Sometimes where during COVID, I know a number of people that said, "Oh, COVID is not there. They are just trying to cook up something to make news," and those data are the only evidence that can be provided to the communities to show them that this thing truly exists. So data is very important when it comes to any disease, and we cannot overemphasize the importance of data.
Okay, so still on data, sorry. I mean, COVID-19 was all over everywhere, kind of thing. So, for I had people very close to me that, oh, okay, I think for data forming from the US, from outside Nigeria, they are correct. But from Nigeria, no, I don't trust these people. Maybe they just so. I mean, even me, I could not defend it. I'm not going to lie. I could not defend it. But then I don't know. This I don't know. Maybe it's because of this stereotype of Nigerians they can just do anything anyhow. So is it? Can you help us correct that, or is that true? That's just even because me I'm confused. It's the thing.
So, I think the issue that we have was more of we don't trust that Nigeria can test for all these viruses. We don't see. I tested for COVID when COVID was there. People that traveled, and there are cases of positive results, negative results, and there was even someone that said he was positive and the wife was negative, the children were negative. So he was like, where does this come from? And you are saying we slept together, the wife was not negative and it was not positive. So he did not trust the results. He went ahead, and I think at the airport when they tested the day, it was positive. So it was that point that he accepted that the data was correct. So the thing is, we there is lack of trust generally in the Nigeria system. We don't trust what the healthcare facilities are bringing out as the results. So we need to like bridge that gap. We need to trust whatever is coming from them first before we can now discuss along
My concern is, are these people, are they all stable? They need to give us reasons to trust.
The world is so for that COVID, for example, when we test COVID, before the result is released, it will be sent to CDC. CDC will affirm and confirm that this result is. And when you are sending the result, you are sending the city value. There's something called city value that will show the threshold of the disease. So it will got it by from the PCR. So there is no how you will get a city value that you will send if you have not done that PCR. So you can always trust that something has been done before this result is coming out. So you cannot just say the result and CDC will now be the one to release the result. I don't know if maybe if I check my phone and I see a sample of the result. If you check that COVID result that came out, there will be a stamp from CDC there. So that shows it's not the lab that is releasing the results by themselves. It has passed through a number of stages before that result is being called a result. You cannot just say this is a result and that person will accept. It's just it has passed through different species. That's it.
There's some kind of disease creature.
Yes.
This might be.
Yeah, it's set up.
Right. So I have a question here. Based on what I can see here, I can see that Lassa fever deaths are the significantly higher this year than the last year. So, what do you believe? Where do you believe the solution lies? Is it in building more high-tech laboratories, or in putting more money into the hands of community local governments areas? Because I find out that there are currently 93 affected local governments, whereas where the death come from 93, yeah, for last year. So where do you think the solution lies? Is it in building more laboratories in the cities, test more people, or to put money in the hands of the community health workers?
So for Lassa people, I would not say building more laboratories. Why? Because even you see there when they test for Lassa fever, you only have one person that is testing for that. Just because if that thing will spill over and affect that person, it will become one person. So we don't need multiple people testing for that virus. It's just one person is enough. And I will not say giving the community, if you are going to do the community DD or they just let me come and contest for a community child. So the solution that we say is, are people really informed about the symptoms of Lassa fever? You don't really know what the symptoms are. So sometimes some people might be having. There was a woman that died recently. They said she went to visit her husband at those. The husband was sick and she provided care of her husband. And she came back and she had cancer and she died. So the husband apparently had cancer, but it was not that serious. It was not severe, the husband. But the wife had it and it killed the wife. Just because when the wife came back and the wife was expressing the symptom, she was like, oh, it's the same symptom that is happening to my husband. Then it does buy the pills is using it. So she was just using paracetamol and self-medication. So I just feel the best thing that we can do is not giving community leaders the need. You give them the recall of blood that they get themselves. That's just the truth. And if you build more labs, the one that we have, you equip them more to be able to test for more people. If they are fully equipped, they will be able to test for more people. Then inform people about these diseases. Let them know what the symptoms are, what the solutions to put.
Now we have you help us with the symptoms. Lassa fever.
Can I read that in there at the top of it's an hemorrhagic fever. So anything that has to do with blood flowing out is there, fever, high temperature, and I think
So if it is, there was a obviously it's rats that cause the mess of God. That's just
yes, was
So
Me-
that one fever, a day. Nah.
No, I think headache should be there.
part of the symptoms is
Headache.
more fever, abdominal pain, headache, sore throat, difficulty in breathing,
That's the rats.
being breathing, then bleeding too.
Okay. Okay, so in talk about this pandemic of Chinese outbreaks, what are the individually, what can I take to prevent this state from happening to me, from me being affected? And the other way, what can, so let's say, healthcare sector there, what can they do to help the community, to help the population?
This so let me start with the healthcare. The first thing is proper documentation.
Proper documentation.
So if there is proper documentation of how the disease spread, the number of disease, it will inform people about the outbreak even before the symptoms get aggravated. So proper documentation, if there is good reporting system and surveillance by maybe the government aiding the surveillance and discovery of these diseases, which will help too. The individually, I've mentioned earlier, the sanitation part, just do the whole part of sanitation first. Then, when we notice an unusual thing about yourself, self medication is not the best thing. And just medicate, I'll be vetting care from uh, healthcare worker, the healthcare, the health sector is there. Then reaching out to people. There are a lot of people that don't know that these things exist. We still ask many people in the market now that what is Lassa fever? They don't know. At least to a point, there is a lot of us that who is coming from lats. There are some people that don't know. So your seed to telling them and I think this part of the point of having a podcast like this that will reach out to people that might not know about these things and in way to get so information about it. So yeah, essentially that is it.
Oh. Talking about access to healthcare now. Yeah, I know we are talking about the urban area now. You may talk about the urban area. How about the people in the rural area where like they don't have access to healthcare? More like they don't have access to the healthcare. I mean, before their time, they can access a very good facility. They have to travel down. Especially those, I mean, for example, people living in my village now, they have to go down or fall to the tap before getting possible treatment or anything. So those people and again before because they have limited access to healthcare. They don't have the knowledge or I mean, so it's not like they are ignorant, but because they don't have people telling them no seminars, no campaigns about it and all of that. So how do we because I mean there's this more like this is one of the major gaps that I have. So how do you survive that role?
Um, on that, there is limits to what we can, although we keep trying our best. Still, that is in the end of the day, we reach there. Or the government has will be a lot to setting up, especially point of cares to those facilities. But I think individuals too are trying. There are a number of people that go on medical outreaches and maybe by that he tend to like let some of those skills, but it's mainly on the government's hand by building those hospitals and all. And individuals that have the money to like finance this can also it, but is it the main point is he should care for even if you said it, care for people to like yourself, love your neighbors as yourself. Means if you love your neighbor, you love yourself. If we are saying we cannot finance this just because we will not getting any benefits, you should always consider that even if you are not getting the benefits in monetary aspects, you are going to get it eventually by saving the outbreak. So if a care is provided early enough so you stop the spread of that disease, maybe that disease will not come and affect us later. So you can do that. We can have that about me. But
And I think, like you said, that Tenet has a lot today. Government can actually get health centers established more, like you said, than VH. like a being I don't have access to. People in our village was not might not have access to um for the ZAX services, yes. So they had to travel down. So governments can actually build more health centers, those BHs, well, like is equipped, yeah, something that will.
Okay, so if they build now, my concern is how will they pay them? You don't even pay them. Yoruba will say, ini kan ló máa ń orí yá. Inú dídùn ló máa ń rí yá. So how will they pay? You know people that, yeah, bá ń settle they are not receiving enough.
Well, we hear about payments sometimes. I think they need to understand the effect of these things. So they don't see the need to build. No. They need to see the need to feed. There should be a reason why they are doing it. So when they understand that, oh, this healthcare sector that are doing it is not just for people in the rural environments, it's called all society at large. Maybe they will understand the effects. It's not about parents. And for healthcare workers, as much as everybody wants to make it and not to get paid, rather, we should also be more considerate of our fellow brothers. That's best it. Did nobody can pay healthcare workers or it's time is nobody can pay healthcare workers with that. So no matter how much that, for example, that Lassa fever this thing I'm talking about, the person that is tested for Lassa fever, if we ask the person, you continue testing for the Lassa fever, or you should pay you $1 million, I'm very sure $1 million without testing, without having to face the potential risk of having that same virus that you're testing for to be, friendliest.
But that can apply to the like, wait,
Okay, so he tested, there was a time that he tested like, I think 15 samples and everything came out negative. The next day he tested just one sample and the sample was positive. So he was to dot by 15 samples. Then the next day, yeah, you don't be like, sorry. Oh, baby, just a need of.
Human being standing, so I don't want to say funny. But we can so there's this name that is called in I forgot it as that in septic but when something is here to like hold you down to the point of death, we not still see the need to okay the barriers, yeah, barriers yeah perceived sufficiency, yes, perceived benefits, yes. So even with this availability of this estate tax, because we need that one estate, there are available like this estate are available in our villages, yes. But small, if I don't still see the need to like go for tests to like to curb the further spread of the diseases, like what can such man like human being do? And even if people are seeing the symptoms around that or in and person still be like, yo, I don't understand people. I don't have the or this and that. So the person is at this at me. Very, very at easy. Yes. So what can these people around they say do? What can society do? Or like, they won't force the person to like to be tested on or to go to the hospital or to go to health center. Even though it's surveying.
Let me just put this. As much as human beings can be difficult, there's one thing that everybody feels he gets. Just let them know the risk, the potential risk that they are putting themselves to by not getting tested in here. Because early diagnosis save lives more than late diagnosis. And maybe just that testing earlier will just be a tip that was needed. So I think most times, as much as they encourage healthcare not to scare people away with the reason, people need to know the risk. You don't get tested, you die, you sprint.
Or you are facing with your love.
Or you can feel, yeah, there are loved ones too. You don't get tested, you are at risk of, and you are putting people at risk. Means so let them know the symptoms, let them know the indication of them not getting tested. In case we now have adamant people that no, I don't care about spy, isolate them. So we there is freedom of unions, there is freedom of speech too, but freedom after speech is not guaranteed that. Same thing with all these things. When COVID happened, as much as there is freedom of unions, everybody that had COVID and they were noticed were isolated. So the freedom of nucleus was 50%. So if there is a community where we have adamant people like that, it's true there is I think according to the law is something that can be done. If a person's act we harm or endanger every other person in that community, the person can be put on police just to save the whole community. Is one lie to save all. So I just feel that one is enough.
This the question. This question. Okay, with the current that's the glass Africa now. So if for instance someone notices the symptoms of this particular disease, should the should this person go to the hospital or reach out to the NCDC? And what's the correct route to go through? Because I believe both the hospital itself, it is those we don't have the correct knowledge and the facilities to undo that particular virus. We need to be transferred to them. So where's the perfect place to be for this particular virus?
Okay, so undetected. So the thing about hospitals is that we need to understand that there are different types of hospitals. As much as there are hospitals, there are community health, there is general hospitals, yeah, general, you see, is a very extra. See, it's your fee. So I don't want to go into that. But there's if you get to any of the hospitals and they test and they discover is something beyond them, there is something called referral. Okay, they always refer. They always refer. So the first thing is not reaching out to NCDC, how to build transfer, sending mails, which they might not even respond. When they respond, so before you reach out to NCDC, that energy that you will put into reaching out to NCDC to come and carry you from the home, put it into going to that community health care, let them test, let them see if it is that same disease that you are talking about, so that there is no misinformation. You can think, oh, maybe because I'm having fever now, it's Lassa fever. No, if I know it's those people that will test and they will, after a number of symptoms, let's say for a particular disease that has 17 symptoms and the person is expressing just one and you are tagging it to that same disease, you might be wrong and you might be correct. So they need to test. And okay, fever, for example, is not that to just a particular disease. Multiple diseases are show that symptom of fever. So you cannot say because I have fever now, it is Lassa fever. If I be yellow fever, if I be the name is able the yellow fever, Lassa fever, hemorrhagic fever, any type of fever. So if there is anything, first go to the community health care if that's what you can get ready the ability. If it is private hospital, go. If it is a general hospital, go. It's those people that will refer you, not you going. If you come to the lab now, say you want to test for Lassa fever, nobody will test you without referral because the kit itself is expensive. So we are not ready to. This is Nigeria. Nobody's ready to spend that much and waste resources on someone that might not be a potential carrier. So as much as we don't
Spray through that time like that when the person keeps walking around trying to get tested.
okay, so what they do in the case of outbreaks, if you have malaria, to get care is not that hard even because it's endemic, it's ready available in the area. But in case of outbreak, there are some places that are designated. And if you watch CDC news very well, they will tell you, oh, in case you notice symptoms like this, and this, go to do CH for your case. So when you get there, it will be easy for them to refer you to where you get tested. But if for a normal malaria, I'm saying normal now. For a normal malaria, and you go to hospital, even the doctor will not quickly attend to you because they feel it's something that all this normal medicine will treat, and they will not be ready to like waste their time and resources on that. This is the river. So
You made a statement that I would like to more address. You said, for example, you send the mail to the NSCDC, they never respond. Well, I don't think that's actually right. Because I saw in the series, I believe Ting was in that story that the wolves had an outbreak or something. And he reached out to the Center for Disease Control and they responded immediately. And then they camped out that place immediately from the rest of the city so it does not spread. So why can't we as citizens reach out to NCDC? NCDC, how did they reach out back to us? And then
so let me ask for a person to person. The emergencies, emergency. Can you collect that one? Just put a call. If there is, let's say fire outbreak. Those fires are over. So before you even, that's for bro. Nigeria, we have, but nobody knows. People are not even aware of that.
I saw your other parents also even try to call it one day or this day. You know,
Yeah, I saw that video.
What is happening? Think of things that you did.
Yeah, the only thing that you can call is NCN.
So I mean, looking at
so we are seeing our SPC is not functional like.
I'm not saying that. Let's display. I'm not saying they are not functional. They are working, they are trying their best. Just that there are a lot of processes. You cannot reach out to me and say, oh, you have this particular symptom and I should come and test you for it. There should be a line that you have to follow. I cannot just test you. So you coming to them, nobody wants to lose their job over the care of another person. So they not respond in that manner. Get through the proper protocols and they can answer.
But my whole question now, like now, is the look of things in Ria. Do you think she are ready for any else? We are prepared for any else. Even if there's an outbreak, no, do you think we more are prepared already?
Okay. I I notice Nigeria problem is not more of prevention. I will like combating the disease when it comes. We face whatever is coming at us. You don't prepare. When COVID happen, nobody knows Nigeria can have isolation centers. Everyone has that. There is a center for infectious disease in every state hospital. Center for infectious disease. But is it functioning? You don't know until there's an outbreak of an infectious disease and you will see them working. You will be surprised at the number of stars that we have. Yes. So we already have these things, just that most are not functioning. We just need. So if there's an outbreak, it will keep people, but we will be able to fight it. Later,
People. Oh. So is it happy? Can they just find a solution to what was the point? Was the should I say choice care clinic with the probably non-functioning self-help and stop taking collecting salary.
well, let me. A contract station. I cannot remember the exact amount a PCR machine costs. For you, there is movements. So if you are testing for viruses, you change the DIE to or that virus where you already eat it is an RNA virus, the cooks. So if you are going to do that, test for that, it will be by using PCR machines, either a real-time PCR, something to just show that there is this disease. Well, we want to invest millions in something that might not have. The number of viruses that we have is the number of families that I really know about is 23 families. Under that family, let's say we're gonna believe the man. That's the family of Bodium virus. There is a hepatitis A, is Coxsackie virus, and there are a number of enterovirus. This is still and K under that same family of yeah. Now take Aramaizo, Jesus, Mumps, Inela, take Automizo, influenza and Poo. So there are a number of viruses. I'm just mentioning a family. I'm mentioning other types of viruses under that family. Now, if you are now saying, oh, make it there will be an outbreak of influenza, and we prepare for influenza, and influenza the background, and measles now happen, we will discard everything that we have prepared for influenza and go and prepare for measles. See? So it's not possible.
So now you can keep what he guy he phones budget results. For not just now.
That's the me.
Okay, this pro. I have to be sure that this thing is happening.
Yeah, that's why the deaths now you now center on how fast you can report whoever they W to. If people are true to the reporting system, the government is able to check the threshold of the disease, or this disease normally happens to 50,000 people. There's a sudden increase and it's happening to 100,000 people. There's a risk coming from that place. So they are able to combat it. But if the report is not coming out like it should, nobody knows. There is limits to what the government can really carry upon. What else they
So takes from secular origins, Daniel was the events his measures like drove to the safest world in the short here. Some new health acts that we can practice to avoid disease, outbreaks, and all like that.
Okay, so the first and foremost that anybody can do to prevent any disease is proper hygiene.
Good washing.
Hand washing, proper sanitary. If you have a cough and all, use nose mask. Proper sanitation is part. Then all those ones, if you can even do that, is enough to like cater for them. The germs under the fingernails are enough to kill people. If we take care of the fingernails, we have taken care of the number of microbes. So it's just from the simplest hygiene to diets and all.
So thank you, sir. For me, I guess I endorse this. I know what this is stuff, but at the end of the day, you have to say something and more like reward to people watching us for professional what we don't pay.
Okay, so uh people watches us, the what is before you blame governments, blame yourself. So before you blame government for not providing all these facilities, have you checked how he managed the noise that they provide? There are a number of waste bins on the streets. Have you ever dropped something truly sell that? Or you drop it by the build? Are you the type that drop referees when there's rape, or you formally discard your base? So before you look at governments as the background, look at yourself and do what is right. Your single act of doing what is right can save the relation. That's it.
Catapultas is
Yeah. And what? Yo,
Mr. Oreoluwa. Thank you very much. So that's a Aldi. So the next session is that's me out there here. Usually have a desk guitar, fill some details as and then there's that's it came from our broadcast. So please help us fill that.
so it is a wrap for today's episode. Uh our net are giving us one or two, and I believe that we had follow these things. It's going to be a beautiful one. And at the end of it's just all about saving lives. right? It's just all about saving lives. So for this episode, I just hope we learned one or two from this.
Amen you province.
For that. Sorry, I was saying, on my parties were just love, but the own part as Anchiki Dibua. Oh, yes. Our works, yes. It's not always the effort of the moment, it joins efforts. So how well as an AKV black, it take care of even your ruin, yourself, your body before point and killing.
I'm talking about solution to you because we
Thank you so much, dude.
Okay, so like I said, this is the wrap of this episode. And this is Say's sign house. See you in the next episode. Bye.